I've flashbacks from my course, my master's courses. That
Yes,
was like the kickoff of the class. Because
recording. Sorry.
you might chat a little bit, and then
Yeah.
it's like, okay, oh, for also like, and we're getting into class. It's like recording in progress. Like it's like a
Yes,
little,
behave. Now you got to behave. The
well,
nuns,
yeah, it's just like a little trauma.
the
It's like
nuns are
yes,
watching. The nuns are watching you. That's how you know.
100%, 100%. Okay, so we're week two
We
into
too. Yeah, we too.
our everything super patch, super happy.
That's super happy hour. Yeah.
And
Welcome.
so we wrapped up sleepy time
Yes,
last week.
we did.
We dove into the importance of REM.
Yes.
We also had a recap of how to wear the patch,
Yes.
create that environment,
Yep.
and now hopefully everyone had a great week of sleep if they had that patch available, and if they
Yes.
didn't
Yes, we did.
have the
Yes.
patch available, make sure you check out last week's episode on
The
Super
rim
Patch
back. Yeah.
REM.
Yeah.
And then but I don't recommend it wearing for this particular show. All right, we want to keep you awake, want to boost you up, and we'll have a very good time. So what about let's talk about the pain patch. I think we're in week two, and we were going to say freedom. And
Right.
I was gonna bring in a clip of Braveheart.
Yes. Freedom. Yes.
Right, right. That's what I always think of. Yeah,
That it is freedom. And actually, the freedom patch is how I got introduced to Super Patch. Because and our friend Mark McDonald, who had that Brinks TV show, I don't know, we don't do the Brinks thing anymore. He's got his own podcast now on a different part of the interwide
yeah.
webs.
He's Mark McDonald TV.
No, Mark McDonald TV. Is it? He's gotten so bougie. I don't know. Gotten so bougie. But anyway, so we were on the Brinks TV, and I had a recurrent spot there a couple times a week, once or twice a week, where I would do like a little back and forth on gut health, my little gut check stuff.
I
And
remember that. I remember that.
yep. And so I was like waiting in the wings on a video conference like this while they interviewed the inventor and CEO of Super Patch, Jay Dollywall. So I had never heard of Super Patch. I certainly did not know who Jay was. And as they were talking, when I listened to what Jay was saying about how what the technology was, how the technology worked, his personal story, I'm getting fascinated. Now he doesn't even know that I'm there. He does not know who I am. And I'm like, I'm logging on to his website. I think I bought probably $300 worth of super patches in that 10-minute period of time that he was talking to Mark because I was so fascinated by it. At the time, I was suffering pretty badly with crippling psoriatic arthritis. Medicines were not working for me. The rheumatologist actually wound up cutting me off of all medicines because I refused to take the IV immunosuppressant
Right.
medicine. I thought that
Okay.
wasn't for me. I wouldn't take it. She took me off all medicines. So now I'm like a crippled up, hubbled mass. And the one thing he talked about was the freedom patch and how it helped with pain. And for me, it was every joint in my body, but probably at the time, the worst pain I had was in my right lateral knee, and I could not support my body weight on it. And it's which made it really difficult to go upstairs, and certainly going downstairs was almost dangerous. And it'd been like that for a year and just kind of like getting worse. And because of that, I couldn't exercise and things were just getting worse and worse and worse and worse. So I thought, you know what? Number one, I bought a Freedom Patch pack. And then number two, the second they finished that interview, I pipe in. You're not supposed to do that because they're recording, of course, but I pipe in and I was like, I'm sorry, sir. I don't know who you are, but what the hell did you just say? Like now I'm interviewing him because I want to know. And he and I off air had like some 3 hour long conversation on the technology and how it works. And it took when this patch arrived, just kind of the way I used it. So I'll start with kind of the suggestion. What he told me personally was, Anna, when you get the patch, he goes, I would have sent you free patches. I don't know why you bought it. I was like, well, because I don't know that you're going to send me free patches and I want them now. So there you go. He goes, the part that hurts you the most, you only need one patch. Even if a lot of you is hurting, you got joints everywhere hurting. You don't need a patch on every joint, but find the worst joint and put the patch as close as you can to that pain. And then he quoted a study that was out of University of Miami, the anesthesiology pain management research group had done a placebo-controlled trial on this particular patch. And the results were basically within 2 weeks, people were using 80% less medication as a result of using the patch. In other words, it was working and they weren't even asking for medicine anymore with an 80% sort of reliability as far as how much pain relief. Okay. So that's what I did. I put it on my little where I thought it was interesting. This is an interesting experience. I put it where I thought the pain was in the morning on my way to work. And after walking around, I asked myself, why did I put it there? Because it seems like it hurts like just below it and to the right. So the next day, I took off the old patch because they last 24 hours. And I put it just below where the other one was and to the right. And as that day went on, I found now actually the pain's a little bit more to the front on the knee. Okay, so it took 2 or 3 days to localize the point of max intensity. And then ultimately, I got to where that knee doesn't hurt at all. And every single day for a month, I wore that patch. After about 2 weeks, I started to recognize that not only is the knee better, but my other joints were better as well. So he was right. You only need one patch. Ultimately, your brain will sort of sort things out and start telling itself it doesn't need to respond to pain. And these results are kind of corollary. There was a paper that was written maybe 2 years ago that talked about chronic pain and that 80% of chronic pain is actually a psychological mind trick. And not to say you're not hurting, but to say there's a part of your brain that just wants to ruminate. It's kind of pissed off that it's hurting and it just thinks about it, thinks about it, thinks about it. 80%. So if you can,
That's a lot.
that's a lot. So it is. So it just when I saw his study and then I read that study and then I had my own experience, it occurred to me. So his patch must address that part of the brain. So his results independently, that's it, independently confirm this outside study that 80% of chronic pain is related to almost like a rumination or an OCD that your brain just naturally does as an emotional component to pain. And so this patch seems to help that, which in my experience was life altering, life changing, to the point where I started speaking more frequently about this. When he asked me to give a lecture at Super Patches a year and a half ago, I happily did so. And then he said, would you mind sitting on our medical board? And of course, I would very happily do so, simply because I know the technology works. It's very unique. I use it in my own patients after surgery. And it's a brand new company. So I certainly would love to see it in the hands of all doctors, all hospitals, because it
As a tool, right?
as as a tool, there's no narcotics in it. It's so when we talk about pain management, the government is all up in our grill as doctors about number one, it's the sixth vital sign or whatever. You can't allow someone to have pain. But wait a minute. You can't write for the narcotics either because those are addicting and you're causing a drug problem, doctor. And we're in this bizarre rock and hard place. And then there's me. And so what's beautiful about this device is that it is inexpensive on a daily basis, it doesn't require a prescription, and there's no medicines. And I personally know it works. And everyone I've tried it on, it works. Is it perfect? No. But does it work? Absolutely. And it's one patch a day. So $2 a day. It's almost ibuprofen levels amount of cost. So we're not talking about a lot. If you're hurting, you're going to take 3 or 4 ibuprofen every 4 or 5 hours because you're in pain.
Right. And let's talk about what that does to your GI,
For
your
sure.
mucosal lining, the
Yeah,
risk
your
of
kidneys. Yeah.
the risk of ulceration.
Yeah.
I mean that I mean
Yeah. So you've got, yes,
the tumble effect of that.
of course. Yeah. Because
Even so, but I think there was always this, if it's over the counter,
it's
then it
okay.
has to be safe, right? I
Right.
think that what touch
Yeah.
on that for a second,
Yeah. Yeah.
because
The rundown is,
people have a
yeah.
really misconception that, I can't get hurt or injured medically because it's over the counter.
Right. Yeah. The real problem, like, I mean, well, let's run them down between ibuprofen and Aleve. Those are in the same over the counter categories. And yeah, they cause gastritis, they cause colitis, they cause ulceration, they cause kidney failure, and they can cause acute bleeding. Aspirin's in that same category. Okay, so you don't do that. You do Tylenol instead. Okay, great. That's liver failure. And
Right, right. Let's pick on another
so the number
vital
one, yeah,
organ,
the number one cause of drug-induced liver failure is Tylenol.
but
And
it's safe though, and it's
yeah,
over the counter.
it's over the counter. And a lot of our pain medicines, whether it's a Vicodin or Tylenol number 3, they all have acetaminophen in it, which is bad for your liver. If you're doing a
Right,
narcotic, they're addicting. They cause nausea, vomiting, they cause constipation.
right,
They actually worsen inflammation, which can prolong the painful state, which is why you get addicted because you keep taking the medicine because you hurt longer. So people who have an injury or who've had surgery, which is a controlled injury, have are slower to heal and slower to recover if they get a narcotic. Forget the addiction part of it.
right. Yeah, it shuts down that prostaglandin mediation, that cycle of inflammation, and how it's going to
Yes.
work through that process to help heal. Uh,
Yeah.
and it
Yeah.
elongates it, which is
Yeah.
never a positive in
Right. And so,
anyone's world,
so
any surgeon's world.
right. So the patient wants to have one pill that they take that works immediately, but those pills don't really work that immediately. And then the patient winds up having multiple complications and whatnot. So the pain medicine is a challenge that we all are aware of as a
Well,
certain.
if you think of okay, so narcotic, right? How does a narcotic work? It is working on your central nervous system to
Yes.
block the signal to the brain. And how's the super patch work?
It doesn't even block the signal to the brain. It blunts your I care about the signal. So the signal is actually still there. You just don't care quite as much that it's there. But again, that is how super patch works. It blocks the signal to the brain, so you just don't care that the signal is there. So you don't ruminate on it anymore.
Right.
It's similar. Now narcotics work on what we call opiate receptors, and it's a very different process. There's a lot of opiate receptors throughout your body. That's why it causes nausea, vomiting, constipation, et cetera, et cetera. Super patch doesn't do that.
Right.
So the super patch is more like a biofeedback than it is anything else because it resets the body to kind of like a normalcy. It can never make you hypo normal, like blunt it to zero. A narcotic can make you stop breathing, right, and kill you.
Right. It can shut down your lung function.
Yes, it can, and that's what fentanyl does, and that's what kills you, right? So, so super patch is more like biofeedback. You're not going to biofeedback your way to zero. It's just not going to happen. There's no medicine involved in biofeedback. The biofeedback for the audience would be something like your iPhone has like a little, thing that you can watch and breathe to control your breathing, and you could test your pulse and you can feel your pulse going down. When that happens, it's lowering your blood pressure. And when that's happening, it's lowering your breath. It's very similar to meditation. What you are doing with that, you're looking at your pulse going really fast. You're concentrating on slowing things down. You're watching your pulse go down, and it tells you I'm doing that correctly. That's what biofeedback is doing. You have to consciously be aware of that.
Right.
And you have to watch and be aware. And the second you stop
And
paying
you're, and
attention,
you are pushing yourself to that state.
correct. And the second you stop paying attention, all the effect is gone.
The doorbell ring, the
Yeah,
dog
bing,
barks,
yes,
the dog
exactly.
barks, everything like beep, boop,
And yes,
everything.
right. And it's
You're
all
out of
gone.
that state, right?
And it's gone. Right, exactly. And you're out of the state. But so the state you're trying to enter into is one that is parasympathetic in its nature. So your body has the fight and flight sympathetic, and then the rest digest parasympathetic. All right. So the modern world has us stressed and we're in the fight and flight all the time. You get pain, now you're
How was
hyper.
your drive? How was your drive home? Right?
Oh, it was so much fun.
Right?
Yeah. Well, yeah, right. Well, I have the aid of a super patch, peace patch, which we'll talk about some other time, which helps
That's
you.
next. Is that next week? I don't know.
It should be. It needs to be. We'll make
Coming
that
up.
next week. That's my lead up to next week. But pain puts you into that fight or flight sympathetic tone where you're just on edge. And because you're on edge, your brain is constantly whirling through all the different ways the dinosaur is going to come get you. And that's what gets you into this chronic pain scenario. So your job is to get out of that and pull into the rest digest. You don't really care what's going on. You're chilling out at the beach. You're having yourself a good time. Your pulse is calm. Your breath is calm. So it's a calming. And so
Holiday, vacation.
I'm on vacay, right? So, and of course, this is why people get addicted to pain medicines, because it kind of drugs you to I'm on vacay, right? But it does it in a chemical way that's bad for you. Biofeedback, meditation. People will get addicted to meditation and yoga and even exercise and biofeedback, where you control your pulse with the biofeedback thing, because it makes you feel good, because it puts you in a parasympathetic state. The beauty of these patches is that it's putting you into a parasympathetic state, and it's very selective because there's a bunch of different pathways in your
Signal.
brain.
It's very
So
distinct signal
very,
that's been
it's a very
created
narrow signal.
within the patch.
Yes, within the patch. So when it hits your skin, that translates that signal to a nervous impulse, goes up the nerves to your spinal cord, goes up to the central part of your brain, and depending on the pattern on the patch, your brain will either shuffle it to the front for sleep, shuffle it to the back for balance, shuffle it out to the sides just a smidge so you don't give a damn, right? So that's kind of how the patches are made. They've been confirmed with EEGs to make sure it's hitting that part of the body. And so once Jay finds a pattern that can kind of localize in one spot of the brain, he then puts it on people to see what symptom alleviates correlating to that part of the brain. So the part of your brain that ruminates on pain is in the amygdala. So it's like thalamus and amygdala, and they're going. They're doing one of these things. So this patch hits that pathway and calms it down.
It's spiking.
Because it was
Spiking.
highly selective, and you don't have to think about it. It happens within a minute of you wearing the thing. In 95% of people who have been studied, these patches will affect the EEG change that it's meant to affect. So, and that's just the creation process of the patch. Pattern, what is the EEG? Tighten up that pattern, tighten up the EEG. Perfect. 95% of people who wear that pattern will have that AEG, period. Like that's how that works. And so, but with the second you take off the patch, the effect is gone. So you don't have to think about it, but it does have to be making contact with your skin. So that's the one caution I would tell people. It's got to make contact with your skin. You don't need more than one. When it comes to the pain, especially if you got multiple focal points of pain, it does help the brain's attention if you get that thing as close to or on top of the pain as humanly possible. That just sort of helps the brain sort it out. And once your brain realizes that's what you're trying to accomplish with this patch, then you wear it all the time. All your other pain will improve with time if it's a chronic pain.
Right. But people there's a lot of people out there that have chronic pain, and now they're listening to Dr. Toker. They're saying, okay, 90 seconds. At least in my experience of just handing it over to people, putting it on them,
Yes.
the acute pain, they feel it.
Yes.
Chronic pain, like what you were experiencing, it took a little bit of time.
Yeah, it's like
because you're almost like you've got to you're retraining your brain to
yes,
calm that signal.
yes. Yeah, and it was
And
coming from
the longer you've been in that chronic pain
the
state,
harder it is.
harder it is to break through it, to go, no, this is okay.
Yeah.
This is
Yeah,
okay.
exactly. Exactly. So I've had patients who they just had surgery and you could put that patch right next to the incision and all of a sudden they're like, huh. What's interesting is unlike pain medicines that'll kind of make you sleepy or you can't focus or you feel blurry, none of that is going to happen to you
Right.
because there's no drugs in it whatsoever. You just recognize that, oh, I walked across the room and I walked across the room. Wait a minute. How did I walk across the room? Like that. I mean, that was literally my experience. How the hell did I just walk up the stairs? What?
Right.
Amazing. It's like, and you almost forget that I'm not supposed to be able to walk across the room. So it really was
Or that you haven't been able to for
for a
X
year and a
amount
half.
of time,
Yeah.
right? Like you execute it, you do it, and you go,
That's crazy.
like, wow, I just made it to the top of the stairs. I was carrying some laundry, some work,
Yeah.
but I didn't think about it. And
Didn't think about
now
that.
I got to the top and I go, oh, well, that
Yeah.
was pain free.
Yeah. I mean, I was having to only use one leg and with both arms on both sides of the wall up the stairwell to get up the stairs. There was no other way for me to walk. Both of my knees hurt, but I couldn't use the right leg at all. And so for me to be able to walk up the stairs, look, mom, no hands, that to me was a miracle.
Yeah.
And so to be able to go and anyone listening to this who's had psoriatic arthritis or any kind of rheumatoid or autoimmune arthritis, just the act of going from sitting to standing is an act of freaking Congress. I mean, it took the amount of pain to change my position was stupid. It was obscene. It was stupid. And so just to be able to go from sitting to standing, like that was my party trick. I showed my husband. I was like, "Look, I just stood up."
Right. And I didn't even.
Ow!
I wasn't clenching. I wasn't clenching. I wasn't.
Oh, it was.
I wasn't gasping. Right.
You had to emotionally prepare yourself because you could feel the pain almost before you moved. You had to emotionally prepare yourself. You could get kind of halfway, your ass about that far off the chair, and you had to stop for about 15 to 20 seconds. And then you could kind of go 3/4 of the way, give that another 15, 20 seconds, and then stand up. Then once you stood up, you had to stand there for about a minute or two to let all the pain out of your body because now you're standing. Cool. There's no taking a step. You haven't taken a step yet.
Right.
Right? I mean, like,
You just stood.
I just
Up.
stood up. Right. And we have a physical exam finding, as you know, Rob, because we're doing that study on balance. It's called the get up and go test.
Right.
And like your longevity is directly tied to how much time it takes you to go from sitting, standing, and walking 10 feet turning around, and then sitting back down. And for me, that was a 5-minute venture. Like technically, if you calculated that, I probably had like 4 years to live, like, I'm like, I mean, this was not good, and so to have something so simple, with no medicine in it, so my brain still works, I could still go to work, saved my surgical career. Obviously, I am in a great amount of debt to Super Patch and Jay Dollywall in particular, as a result. So I can't say enough great things about it. That's just my personal experience. But I think if you ask around other people with chronic pain, they will have very similar stories. Does it mean I have no pain? No, it does not mean I have no pain. Right? But it
Yeah.
means I am a functional human being again.
Yeah.
Yeah, and I got like old person pain, but that's okay. I can handle that.
Right.
My joints
And
are
and
getting
and, and
hard
so
and
you,
swollen, but that's
well,
okay.
listen, you're active. You're in the operating room. You are on the robot.
Yeah. Yep.
You can get in and out of your little sports car.
I
That
can.
I mean that I mean you would have been, you were on track to have the wheelchair up
Yes,
the back
of a van.
of the
Yes.
van,
Mhm.
basically.
Yeah, we would have not, my husband would not have bought a sports car for me if I were still in the state of disrepair.
We would have to
Um,
peel you out of it.
I wouldn't have been able to get in it so low to the
Well,
ground.
we could throw you in like a sack of potatoes, and
You would
then
have
and
just
then and
trying,
then you'd have to hoist you out and
if they would come up with a personal robot who could just sort of like carry me out of a car, that would have been perfect. But anyway, so for
much
anyone
much
out there
better
who
this way.
experienced it, yeah, I can't say enough about it. And honestly, the only thing that can make that patch better is if they came 30 to a pack, but apparently they're going to start packing 30 to a pack. Right now there's 28 in a pack.
Right.
But it's a once a month monthly ship, right? So then you start to panic, and you buy
An
extras.
extra one. Then you got the
Buy extras. But now the patches are going to come 30 to a pack. And I still keep extras because if anyone in the office has a little pain or something, I slap them on there. But yes,
so where do you find yourself wearing your patch right now?
well, so I no longer wear it on my knee because
Right.
I don't need to wear it down there anymore. But that's where I wore it for 30 days.
Right.
I have a tendency because I want the thing to make contact to my skin and held in place in a spot that's not too sweaty, that doesn't bend too much. So I have a tendency to put it like on my hip, basically.
Mm-hmm.
Right?
Tight
So
skin.
it's not in a fold of skin, and I don't particularly, it's impossible to make me sweat, so I'm not going to sweat it off. And so it'll stay for that long until I take a shower. And then I peel them off in the shower because I wear more than one patch. And so my ass is littered in patches. And so I just peel all those off in the shower and I dry off. And about an hour later, I slap them all back on and then I go to bed. So that's what I do.
Working.
Yeah.
Working. Yeah, no, I think it's important for people to level expectations,
Yes.
and that you're in essence uh, reformatting your hard drive.
Yes.
Think
Yep.
if you think about having a virus in your software and think, okay, so now I've got to first I gotta locate it, isolate it, and
Yep.
now I have to get it so it's not affecting the performance of my computer, which is the performance of you as a person.
Yes.
And sometimes things take longer than others.
Yeah. Yeah. It's just like a control alt delete, so to speak. And each patch control alt deletes different networks within your brain, and it's a very temporary thing The second you take the patch off, the problem can come back. So this is a physical therapy device. It's not medicine. It's not a cure. We're not diagnosing anything. But the expectation should be life is easier when your brain is in a state of homeostasis, and that's what we're trying to achieve. So is it perfect? No. But you'll not find a perfect solution to this particular problem, in my opinion, as someone who operates on people who are in chronic pain and whatnot. And it's just, in my opinion, an awesome starting point. And between that, and a little bit of time and expectations, you know, it's certainly,
It's a nice addition to how you
yeah,
treat your patients. So
yes,
from the pain management within your practice, is really going out to the
yes.
surgeons that might
Mm.
watch a snippet of this. What's your protocol that you would then start them a little bit early, keep them on for X, and then if they want,
Yeah,
they can.
I,
How do you do that?
yeah, so in my practice, I run a narcotic-free practice. And when you consider the types of surgeries that I do, traditionally are considered quite painful.
Big,
Um,
just big surgeries. I can attest to that. And
so, but I don't write for any narcotics. And how do I do that? So, proper nutrition, non-inflammatory diet is the first thing that I tell those patients. There are some herbal supplements that are anti-inflammatory. I will have people use turmeric and N-acetylcysteine are in that category. When it comes to these patches, I will typically suggest multiple types. The first is this freedom patch. And it is a good idea, in my opinion, to have it on there at least a day or two ahead of time, just to kind of everybody's nice and calm.
that's
Okay,
right.
before we get started.
I
I
think I think if, I think if everyone walks in with some sort of
Yeah,
pain of some sort
hell yeah.
after
Well, and
after a certain age, everyone has something where they go, yeah, oh
well,
yeah,
and,
don't treat
and
it.
what I would say, the one of the things that we learned, and they were doing a lot of studies on this when I was a resident about local anesthesia during surgery. And there was a big debate. Why do I have to give local anesthesia if the patient's under a general anesthetic? And it came down to, well, pain control after surgery would help the patient. Oh, okay. So we used to do the surgery and then inject the local because it would last longer. But as it turned out, if you inject the local before you make the incision, the patient has way, way, way less pain. So
Yes,
you can block the signal before pissing everybody off in the first place, the patient does better. Okay. So having said that, I like a little bit of a freedom patch on there. Surgery freaks people out. It causes a little bit of stress. It puts them in that fight or flight situation. So I want them to have a peace patch on. The other
absolutely.
thing, yes, absolutely. The other thing that I have found in patients who have surgery, they get disoriented. They kind of like feel a little bit of dizzy because their blood pressure is doing all this. And the way we position patients in the operating room, the anesthetic that we give them.
Well,
So
when you come out of surgery, right?
yeah, you're all
You're just
goofballs. So
you're literally like, where am I? Like,
right.
hold on.
So for that reason, I will put a Liberty patch on people, and that's for balance. That's the patch that we are going to be that we're testing to help people not fall and bust their chops on a fresh incision after surgery. So those three things, and if they
Not
cannot,
recommend it.
not recommended. And if they can't sleep, again, because I don't want them taking a drug that makes them groggy and whatnot, I have them do a REM patch, which we talked about last week. So those are 4 patches that I suggest to anyone who is having surgery. Then during the surgery, yes, I'm going to put in local before we make our incision. And after the surgery, we're going to make sure we have like a muscle relaxer on board. Yes, you're going to be wearing the patches even in the hospital, et cetera, et cetera. And so the course of doing that those patients are more active after surgery. They have less pain after surgery. They're in and they're out. They're less likely to have a complication as a result. So that is what we in surgery call an enhanced recovery after surgery protocol.
Yep.
And so I have just kind of modified a lot of those steps to add the nutrition, a little bit of the herbals, and then the super patch piece. And it has made me enormously successful as a surgeon, despite how pain. And I've had patients who've had tons of surgeries and tell me, I don't understand why this surgery did not hurt me. I've had surgeries before. I don't understand that. This is the biggest surgery I've ever had. Why was it the easiest one? And it's just multifactorial,
Right,
just
right. And
we approach
you
it.
have, 20 plus years of surgery using
Yes. Yeah.
traditional methods of
Yeah. Yeah. Yeah.
narcotics,
Yes.
over the counter pain relief,
Yes.
and now
These
more
things. Yeah.
recently now adopted this
Yeah.
type of protocol into your
Yes.
practice to then go, oh, you know, this
Yeah.
is better for my patients, better feedback, and your surgery hasn't changed, so it's not
No.
that's consistent, right?
Surgery is the same. The difference is the things that we've added. And, if you've got a patient who is about to have an operation, yes, it is 4 different patches, but you know what? If they make themselves an online account, become an associate, they get a 25% discount. The next thing you know, they're kind of they're set for a prolonged period of time as a result, because they're going to realize I can sleep at night, make that REM patch and auto ship. You're going to be out of your pain once you heal from this surgery. Then you just keep some in the drug cabinet in case someone twists an ankle or something like that, right? So,
And oh, by the way, all right, it's from a just, I been traveling El Paso, Nashville,
yes,
Sarasota,
yes,
Miami, New York, and
yes,
that was my week.
yes. Oh
So
God.
I mean, and so sleep function, pain function, just moving function,
Yeah.
that even your protocol, which is right here, these
Yep.
colors, right?
Yep.
So you kind of like the purplish, you got I call this infantry blue.
Yes.
This is your freedom, which is the red, and then this is like a
Yep.
purple and a
Yeah.
turquoise or something, right? So this is still less than the Starbucks that I got at the
For,
airport.
yeah, for
Right?
sure. Airports.
This is still less. This is
So
still less than my Starbucks. And I don't think
correct.
I
So
didn't get as
you're
much
talking about
as
less than,
much joy and relief out of my Starbucks
yes.
as what you are
Right.
prescribing for your.
So you're talking about $8 a day in the perioperative period of time. And but again, if you are an associate getting a monthly shipment to your house, all of a sudden you're getting a perpetual 25% off.
Right.
And so the sleep, and you can change what they ship to your house also. You don't always have to ship the same little packet. So
Yeah, I
sometimes
moved mine. I moved mine around.
yeah, yeah, me too.
I'm like, okay, I want.
Yeah,
Well, you know what? I'm getting low on this.
yes.
I'm gonna auto ship.
That's
I'm gonna auto ship.
fine. Yeah. And there are days where I'm wearing 6 of these patches, and there's days where I'm only wearing one. So it just kind of depends on what's going on in my life. But I'm always wearing the blue one. I can tell you that right now. That's my peace patch.
This one. This is the infantry blue.
100%. That is the one that I wear at all times. So
And the people around you probably enjoy you.
in the opera,
Right.
surgeons, Rob, you're no stranger to surgeons. We can be persnickety little people, when things aren't going right, the F-bombs start flowing, you get short with people, especially if it's like someone new who's never helped you, and the equipment not working right, and the anatomy is not right, difficult.
they didn't pick your pick sheet right, and your sutures aren't there, and you just
Sure, right? So never have
you're like, am I in the right room?
Right. Yeah. I've been doing this surgery, this same
Is
surgery in this room for 17 years. I've done 2,000 surgeries in this operating room. That card is never right. No, see, I'm getting fired up about it right now. And I don't look redheaded, but I was born as a redhead. And so my personality is very much a firebrand, as most surgeons are. I defy you to meet someone who's a surgeon who doesn't have this personality. But if I'm wearing my peace patch, then I can tell a joke and have some frivolity about my consternation, if that makes any sense. I still get
absolutely.
like, persnickety, but I can do it in sort of a fun
You've
way.
raised your threshold of
Yeah,
tolerance.
yes,
That's
yes,
exactly what it does.
yes,
So that
yeah.
so that it's gotta you gotta poke the bear a lot more.
You got to poke the bear a lot. And even when you poke the bear a lot and I fly off the handle, it's not nearly as bad. It's not nearly as many F bombs, I'll be honest. You can ask anybody who's around me, and then it's very short lived. And without the thing, I cannot say that's true. You poke that bee's nest, I will be a freaking hornet for the rest of the day. In fact, I might be that way every
The
time
next
I
day,
see you. Yeah, that's right. Every time I see you for days. So, and I can't help it.
it's the carryover effect.
It's name a surgeon who's not like that, Rob. Do you know? And we could be the nicest, most normal people over a beer, but in the operating room, like we got to have the stuff just right. It's our personalities.
But
We want
that's
it right
well,
because it's for the
of
patient. It has to
course.
be done right. I need it. It's just, this has to be perfect. And nothing's ever perfect. So you're always like a little curmudgeonly, a little salty. You get a little salty when things are not perfect.
Right.
But my peace patch, salt free. It's like salt free, completely salt free. So, and we'll talk about that next
That's
week.
kind of how I'm with the joy patch.
There you go.
It takes like like the little things will before I would just
Yeah,
that's like it's like oh I
whatever.
I would it runs off a little bit.
But it runs off. You know what? I have to admit, I've never done the joy patch because I've been so chill with my peace. I don't want to mess with my mojo. You think I should try a joy patch?
I don't know. I did it before the meeting because I was like, you know,
All right,
I think
I'm
I
gonna
need
do
to
it.
I think I need
And
to try this. I tried it before the meeting that we had
yes, in Orlando.
in Orlando,
Yep,
January,
yep,
because I wanted to kind of cycle through these,
yep.
and I hadn't taken it off.
Yeah, no. Well, okay.
I was
Let me
like,
pick
ooh,
a weekend. I'm gonna have to pick a weekend where I'm not in the operating room. I
right.
wonder if can you peace and joy at the same time?
Well, he would say they're working on two different functions, right?
Well, they are.
well, I mean, if you think of
Okay. I will
serotonin, dopamine,
I'm I
you-
will order some joy patches. I will order them. I'll order them tonight.
if I
And
was
then
next to you, if I could, and some,
right.
you know how you do that in the,
I had a packet. I gave it
and
to
all of a
my daughter.
sudden, a little piece comes through.
Yeah, my daughter does the peace and joy at the same time, but of course she's also like ADD and anxious, and so she's got the focus, joy, and peace kind of going because she's a 21-year-old college kid
That's
who
right.
is about to graduate with honors, by the way. I'm just going to throw it out there. So she's graduating with honors. I'm very proud of her. But anyway, thanks to these patches, she's off all of her medicines for the last 2 years because of super patch. I can't tell you how many lives the super patch has changed. It's been an absolute pleasure to be on their board and everything. But all right, I've
And
got
not to
to
be
run.
not to be Snoopy, but it's just because I'm curious. But what meds was she on?
She was on,
And then
and everyone,
what did that program look like to get her off?
everyone listening will hear these stories. Both of my children are horribly ADD, both of them. Where would they get that from, I wonder? But
Are they adopted?
no, they're very much my children. So they're ADD as hell, and to function in school, because in modern school you can't be twitchy around in school. Like the teachers don't tolerate that. So we had the kids on ADD medicines. Now COVID hit. and my daughter was a G.
So what were they taking? What was the drug?
They were, my son is now on Adderall, but my daughter was doing Strattera first, and then she was on Concerta. Does that sound about right?
Yeah.
These are ADD medicines.
Right.
Um,
Like a longer acting.
the longer acting, so you don't have to take it more than once per day. The Strattera is not even
Not supposed to give you an amp, a high.
not, and it doesn't. In fact, it makes them sleepy. They hate taking it. But the side effects of the ADD medicine were very weird for my daughter because she felt like, on the one hand, yes, she could focus, but everything kind of made her jumpy and anxious. And now it's COVID. And if you know any 18-year-old girls or 17-year-old girls during COVID, they all went lunatic time, right? TikTok was going with all the craziness and the world was just nuts. And that's not good when you're 17 years old and a little anxious.
Hormones.
And a
Throw
hormone.
some,
Oh
throw
my,
some hormones to it too, please, people.
please. So all right. So she got the ADD.
And they can't see the girlfriends, they can't see
The friends, no, she did not have homecoming, prom, name high school experiences. She was a junior and senior, missed all of that during
right.
that period of time. She had none of it. Never had a homecoming, never had a prom, none of that. At her graduation, she got to invite 3 people, me, my husband, and my son. Grandparents couldn't come, friends couldn't come. I mean, like
And that was more than most of the country.
more than most of the country because we're in Texas. That's
Because
exactly
everyone else did it virtually.
right. Okay, so here she is. She's on the ADD medicines, feeling crazy and getting anxious. And then she was very brave and she told us she was feeling this way. And she asked, could she maybe go to like would a therapist help? I mean, I'm having all this anxiety issues and I think it's COVID. And I thought, you know what, that's probably not a bad idea.
Right.
It's COVID, you're a teenager, and let's have a professional. Okay, well, that
So
professional,
let's have a professional conversation outside of mom and dad.
yeah, not mom and dad.
Right.
She was just brave enough to tell us that she was having this issue. This is cool. I'm gonna let somebody else handle that because I don't know anything about that. Other than I was a teenage girl, I don't know anything about that.
Teenage girl that, then times have certainly changed.
No, times have changed, and I have to admit, I don't want to say autistic, but I don't have the same kind of emotions that my daughter has. I'm like, she's very artistic. She's very emotionally labile. She's very empathetic. I don't have any of that. I'm a surgeon. I have no empathy.
Right.
I'm
You
robotic. I
fix,
fix things.
fix.
It's my
I
personality.
see a problem. We're gonna fix it, and
I'm gonna fix it.
you're gonna be humming, boop, beautiful.
Correct. And if I can't tell a joke about it, then I can't fix it. Right. So I thought, you're right. You need to see a professional. We send her to the professional. The professional writes for some kind of anxiety medicine. Okay.
I'm putting my joy back on now.
Yes, right.
While you're talking,
So now she's on an ADD medicine and an anxiety medicine. And by now she's graduated high school and she's on her way to college. Now she's not at home. She can't tell us what's going on. She's having to manage by herself around strangers in a strange town 10 hours away from where her parents live.
right?
So the anxiety gets worse. They start adding other medicines. And so this therapist,
The walk-in clinic.
yeah, well, the therapist, she had a therapist.
Okay, up
A
there,
well, actually,
I'm down here.
they were telehealth at Parkland
Okay,
at UT Southwestern,
all right,
They had a telemed psychiatrist and was doing the therapy. And to me, therapy is like you're talking to someone that you can't tell your parents or whatever. That doctor was writing prescriptions like crazy time to the point where the child was not functional. I worried, how is she going to make it through school? And we went up there to visit her almost like to like look in her eyes, and I'm looking at all these medicines prescribed to my child, and we're like, okay, no, not taking that, not taking that, not taking that. We took her all, as soon as the semester was over, she came home and we had to detox her from all these medicines.
yeah. Yeah, you can't just pull them. off.
Yeah. So, right. So we didn't do a summer semester. We detoxed her from all the medicines. I made her do microbiome testing. So, because she had gut health issues. Everyone with anxiety has gut health issues.
Right.
So,
Connected.
yeah.
Connected.
Hello. Yeah. They're totally connected. Okay. So they have gut health issues, are connected. And then we started switching her off of her medicines to Super Patch. So now she does focus instead of her ADD medicine. She does her peace patch when she's feeling anxious. And if for whatever reason the doldrums in life get her, she'll slap on a joy patch. Right? So it's like, and that has changed her life and her world. And we got our daughter back. Like, it's one thing to not be in pain and to be able to walk upstairs, but to get your kid back, like it's invaluable. I told
Right.
Jay, no matter what it is he wants me to do, I will help him
Right.
the rest of my eternity for inventing this and
That's
saving.
but that's the mom, like,
Yes. Yep.
you know,
I am forever loyal. The guy can call me at any point in time. I will drop what I'm doing and help him for that. So, anyways, that's kind of what we were doing. And I've not tried the joy patch. I've always given it to my daughter, but I will. I'll do it. I'll
I
do
think
the.
you're gonna love it, but I'm not saying anything because
I know I'm going to try it. We'll see. No, because one of the things that I found is if people don't have a symptom or a problem, it may not actually help.
valid.
So I don't really struggle with anxiety as much as I struggle with stress. And I don't really struggle with anger as much as I struggle with stress. So it never occurred to me to do the joy, you know? If you're not
Well,
hurt,
I don't think of myself as a unhappy person.
yeah. I bet you it must hit on the super piece. All right, well, we'll see. I'm gonna find out.
Yeah, you're gonna check it out this week, or you're gonna wait?
I'm gonna have to check it out this week.
So then we can next week we're
Yeah,
gonna we're gonna follow up with
yeah.
how you
I'm
feeling
logging on to my
how you feeling on the joy patch.
yeah, I'm
We're running little experiments here.
we're gonna run a little
Little
experiment. I will
scientific
tell you,
studies.
I'm ordering and the company's pretty good. I will have these patches within the next 48, 72 hours. It doesn't take them long.
No,
So I'll have a few days down the hatch,
to
which may or may not
before next
be
Friday.
before next Friday. Yep.
And that's a perfect place to end.
All right, cool. Let's do it.
So
All
now
right,
we've
cool.
got we've talked about the having better sleep, having some pain management protocol with the freedom,
Yes. Yep.
and we just did a little smidge of peeking into uh, the products that help your surgical practice, as well as that 18-year-old teenager, boy, girl, doesn't matter. It's just
Yes.
it's society right now that
It's
these
teenager
products
hormones
can
and COVID. Yep.
help increase their focus, their coping, their management, their stress management. I think it's a there's to your point. If you're not getting benefit, give it a little bit of time.
Give it to
Gotta let it do its thing. So let it run through, and then see if there's some upside to it. And if there's not, you're out. $5. I mean, everyone's had a bad meal, right?
yeah.
They've left the restaurant. How was dinner? And they go, it's
Yeah.
fine.
Yeah.
Not gonna go back, but you know.
Yeah. Very good.
So Joy Patch ordered for you.
Yeah. Yeah. I'm doing it right now.
All right.
Having a look. Is it under wellness? I'm
So
shopping.
for all the people that will catch little sound bites about our super happy hour,
Yes.
you can go to the Arms Medical website, and there's a link
Yeah.
right there. You can go to drannatoker.com, and there's a link there, and you can get your product.
Yeah,
Try
absolutely.
it out.
Yep. I'm ordering right now. Right there. There it is. Boom. It's on my little phone. All right.
Done.
Yeah. And I take my 25% discount. Thank you very much.
That's right. Oh, and I think they got a promo coming over, doing something right with the 4 patches and.
They do, and I don't know all the details. What did Terry tell us? That starting in April, if you buy 4, you get the 5th variety free.
Yeah,
And that's on top of your 25% discount. So, I mean, do
but
the math.
I think they're gonna, if you go to the website, I think, they get it, everyone can benefit from something in
Yes.
this product line. And then of course,
Yeah.
and you can see whatever specials, and they're always looking to try to bring more value to
Yep.
you, the customer, and for us, bring you relevant information that can help give you a better quality of life.
Yeah.
That's what we
Absolutely.
need,
Yep.
week in, week out.
Exactly.
All right.
All
You
right. The
have a
patch,
wonderful weekend.
yeah, you too. Patch is here. It's on its way. And we'll talk about it next week.
Okay.
I gotta
Joy.
go to my face to get my Apple Pay to pay for it.
There you
All
go.
right. Okay, good.
Bye.
All right, bye.